skin rolling. I'm going to talk about skin rolling. So basically what skin rolling is pinching the skin with your thumb and index finger or the first three, and then rolling your fingers along the skin, okay? You can do this anywhere. I'm going to focus on the abdominals and into the low back. So that is where I target for postpartum women. Also pregnancy, it's great. You know, if you're having rib pain, the skin that you can lift on the sides, that's great to skin roll, especially low back if you're having low back discomfort. But I'm going to focus here, so let me just tuck my shirt under. Okay, so I like to start up at the sternum. Okay, I learned this technique through Dr. Sarah Duvall's course that I took, and it feels so good. So it's great if you carry tension in your abs, which a lot of us tend to be ab grippers. I find many postpartum women grip their upper abs. And so this is a great technique to release some tension there to help our core just work properly. And especially if healing a diastasis too, you can do this all along your midline. So if you start up at the sternum. Again, I've got my skin pinched and lift. I lift and pinch, and I'm just rolling all the way along, all the way down. And I can even go down into my low back here. Okay, I know you can't see that, but it's pretty pinchy back there. So if I have some tightness, it might feel like somebody's pinching you pretty hard. It should get better the more you do it, but if you're sore the next day, you may just want to back off, take a day or two off of not doing skin rolling, and then pick it back up when you feel like you've recovered. But a little bit of soreness is okay. Just be cautious if you're taking blood thinners. You know, we don't want to do anything that's going to further damage your skin, so just be cautious with this if you're doing it too hard. But this feels so good if you have any tension here in the abs, and then also in the low back. If you have somebody, your partner or spouse, that can help you all along the back muscles, that's a great way, especially if you're having a hard time feeling your back expand when you're breathing. So work all the way up and down the back muscles, get these obliques here. And then you can also start down here, so just in front of your hip bones here, and then you can roll up the opposite way. So kind of this way diagonally, and go back down all the way down there. And then you can also go all along your diastasis. So up here at my sternum, I'm a little bit tight here, okay? So you might just pinch and lift here and kind of hold that and breathe. Okay, so you can do that along your sides too. If I were to feel maybe I'm having a hard time breathing in my sides, I could grab here and just hold. And breathe, okay? Loosen up that tissue so our rib cage can move and everything can start to work like it is supposed to. You can go up and down all along your linea alba, the midline here, connective tissue, get all the skin and fascia and muscle that sits there. This can be great for diastasis healing, going all the way up and down. It's also a great technique for C-section scars once they're fully healed. So make sure you check with your provider before you start massaging and picking up and lifting the skin over your C-section scar. You want to make sure that it's fully healed, no signs of infection or anything like that. Typically that's around 6 to 8 weeks postpartum, but some people take longer to heal, some heal faster, and but we want to get that scar moving. So this is another great technique that if you feel any like lumpy kind of bumps underneath your scar, or just the tissue feels stiff, not moving like it should, or you have any symptoms like back pain or any urinary symptoms, that's a good sign that you maybe need to get your scar moving. But the first step with that is being able to touch your scar. So I have more videos on that, that's for another conversation, but I just wanted to say that we do want to get our scar moving, and skin rolling is a great technique for that. So release those abs, work on your abs, your low back using that skin rolling technique, and I hope that helps release some tension so that everything